Oh, okay. Let's see. Thank you, Selena. Appreciate it. Sorry that you can't unmute. I don't know why you can't. Well, good morning. Thank you for joining us today. I'm excited that this is a smaller group and maybe we can have some discussion. If Selena can get off of mute, that would be awesome. So I'd like to introduce myself. My name is Shannon Sandel. I do work for Endpoint, which is the company that is helping the state of Nevada to implement the Epitrax system. I'm excited to talk to you about Epitrax today and excited to have you all start training in this system and getting comfortable with it moving forward before the implementation. So we'll go ahead and begin our training. So this is the dashboard. It is the initial screen that you see when you first log into the system, and it does display the tasks for you in this system. And we're going to kind of leave this here for right now, and we'll come back later and talk about the entire task process, creating tasks and managing tasks here in our next discussion. But for right now, we're going to go ahead and talk about the system itself, how to search for a person in the system, how to create an event for that person in the system. We're going to talk about workflow, being able to assign and reassign investigations, accepting those investigations. And then we'll talk a little bit about the differences between person and event records in this system. So that's what we have slated to discuss here for this session today. So when you first log into the system, I would really encourage you to please come here to the top right corner to the settings. Click on that. And I would ask that you please make sure that all of your information is filled out here. So specifically, of utmost importance is that first name and last name, and we'll talk about why here later. Also, phone number, make sure that that is in there and correct, and email address, and we'll talk about those items as well and why they're so important to make sure that they're included here in the settings. You'll also see there are a couple other tabs here in settings, and those both have something to do with tasks, and we'll talk about tasks later, so we'll get back there as well. So that's where I'd ask you to go. First time you log into the system, make sure that that's all set up. Right now, we're going to come here to New CMR, and we're going to perform a search in the system for a person. So best part of the records that will be created in the system will be automatically created by the system itself. So anytime an electronic laboratory report comes in or electronic case report comes in, those will trigger automatic creations in the system of events. And so we'll just talk about how you can manually create a person and event record in the system. I know under ideal conditions, everything would be electronic. We wouldn't have to mess with faxes or paper or emails, but in the real world, we do. And so we're going to talk about how we do that. So I'm just going to go ahead and search for a person. As with any search, the more information you put in, the better, the more detailed the search will be. But for our case here, I'm just going to enter in our last name and first name. I can hit enter. You'll see here that there are a few different people in the system with the same last name, first name, but different dates of birth and different phone numbers. Also, there is a scoring criteria for your search. So if I had put in more detailed information, so I'm just going to grab this date of birth here, plug it in up here. I'm going to grab a phone number, plug it in up here, and then I'm going to search. You'll see here that if I have more search information, it really limits my search. It's just going to pull up that record that is a 5-star exact match for me. I'm going to go ahead and delete that out and search again so I can show you what this looks like. Okay, so if I'm looking at these different Shannon Sandel test people, same first name, same last name, I see that they have a different date of birth, different phone numbers. I can also see the number of morbidity events they have in the system, the number of contact events that these people have in the system. If I want to take a closer look to really make sure that this is the person for which I am searching, I can click on that person. I can come down here and click on demographic. It's going to bring down their demographic history. So you can see here things like their date of birth, which we could already see, but in addition, their current age, mortality status. I can see an address history. So this person has moved quite a bit here. Can go down and see telephone history and email address history. I have the ability of seeing other demographic information such as birth sex and current gender, primary language, etc. Then if I come down here and click on events, I can see all of the events that are associated with this person in this system. So you'll see here that this person has lots of different events. I would like to point out that I can only see the events for which I have, if I could speak, that's helpful too, for the conditions for which I have access. So in this case, if I didn't have access to gonorrhea cases in the system, I would not even know that this gonorrhea record exists. I do, however, have access to all of the gonorrhea records, or I can see all of the gonorrhea event records in the system. So I am currently logged in as a Carson investigator, but I can see this DHHS event, but I cannot access it. So if I were to click here on this hyperlinked event record number, it would take me to a page that tells me I do not have access to this record. So once again, if I have access to a condition, I can see all events in the system for that condition, but I can only access the events that are inside of my agency or my jurisdiction. You'll also see that there's a little bit of color coding going on here. And the color coding indicates workflow status. So you'll see those records that are assigned to me are displayed in a pinkish kind of a color. The ones that are assigned to the local health departments are kind of I guess a green kind of color. Assigned to investigator, when it's someone else who's the investigator, is a different color. So there is a color coding associated with our workflow status. Also, this color ring on the outside of the event indicates whether it's a morbidity or a contact event. The green here outlining these events indicates a morbidity event. And you can also see that here. And we'll go ahead and kind of drill down some of these events. If it were a contact event, then that is indicated by a yellow outline. So the system is really trying to help point out to you, hey, this is a morbidity event, this is a contact event. It's really trying to help you to be able to really understand what's going on with the color coding, with the workflow status. So lots of visual indications beyond just words. When I'm here on the Events tab, I have the ability to go click here, and I can go in and edit an event, or I can come over to the far right and click on Options, and then I have the ability to edit or view the event, or edit or view the person. And as we go along, we'll show you what the difference is between the event and person records. And then the last option we have here is to look at the lab history. So if I click here and then scroll down, I can see this person's lab history in the system and their associated cases. Once again, this is dependent upon my condition access in the meeting. So whether I can, if I don't have access to hepatitis B, for instance, I won't have access to this laboratory result either. Okay. Are there any questions about what we've discussed so far?
Is my mic working now?
It is.
Oh, good. I'm so sorry about that. No, I'm good. I just wanted to make sure that you guys could hear me. Thank you.
Oh, you're welcome. Thank you. That's great. Also, we can come over here to the far right and we can click on Edit Person. And this allows us to go into this person's record and edit. And once again, we'll get there and talk about the person record here a little bit later. I can click here on the Add CMR, Create CMR for this person. CMR is a confidential morbidity record, just so that we have that definition out there, and it is used quite often in the system. So I wanted to make sure that everyone understands what CMR means. I also have the ability to, after I've gone through and I've looked at these different people and I've decided, maybe I decide that, hey, none of these people or the person that I'm looking for, I can come up here and create a person in CMR in the system, and then I can start from there. For our purposes today, we are just going to come down here and we're going to add a CMR. So I'm going to click here. You'll see it takes me to a screen where it's going to show me all of the events associated with this person again. And it's basically saying, hey, wait a second, please take a look and make sure that you're not creating a duplicate CMR for this person. Please review these events again, just to double check. And then it gives you access once again to these events by clicking on their record number, so you can go in and take a look if you have access to those agencies. In order to create a new event for a person, it's going to ask for a few different pieces of information. So the first one being date first reported to public health. So I can either click on the little calendar icon, I can come here, I can click on current date, and that will default to our current date. I can choose another date using the calendar icon, or I can type in a date. So we're going to talk a little bit about the formatting of dates when you manually enter them, just so that we can make sure we're all on the same page. To enter a date in Epitrax, you do have to use those slashes. So I could enter in the long date. Ooh, if I don't enter in extra zeros there. Or I can enter in just the 9/2/2022 or 9/2/22. Oh my goodness. But I do have to use slashes. I just wanted to point that out. That's the same across all of the dates inside of the system. Also, if you, yes.
Is Alexander waiting to get in? Do you know?
I don't see anyone waiting. I haven't had anything pop up.
Okay. Sorry, he just emailed me. He said he was able to connect but needed to be let in. So let me see if he can try it again. Sorry to interrupt.
Yeah, no worries.
I think he's trying to get in over on a Teams because I keep getting an alert too. I don't think he has the Google Meet.
Okay, I'll send it to him directly then. Thank you.
Sure.
Perfect. Also, I neglected to mention that when I'm inside and using the calendar date and I choose my calendar date, I can either close out by clicking close or just clicking outside. For me, that was kind of a different type of a workflow. I expected like some kind of a save or something, but you just can close or click outside of the box. We'll come up here, we have to choose our disease. I think I'll just go ahead and choose Hep C this time around. And then if I had access to multiple jurisdictions in the agency, there would be a third field here that would allow me to choose between the agencies for which I have access. In this case, I only have access to Carson, and so the system is just going to automatically default to Carson. Go ahead and click on Save and Continue. Okay, there's Alex. Okay. Good morning, Alex. Okay. So now we're inside of the event. The default tab here is the demographic tab. But before we move through the tabs, I wanted to talk a little bit about some of this information up here in our little banner. You'll see that you can always see the last name, first name, record number, no matter which of the tabs you're currently working from. You can also see the event type, which in our case is morbidity, the workflow status, and we'll talk about workflow here in a bit. You can also see once we assign an investigator, the investigator name, the disease, our investigating agency, when a state and local health case status has been set, those will display here as well. And then also the event date. We'll go through all of the tabs here inside of our event first, and then we'll talk about some of this other functionality that you see up top. Okay. So here on our demographic tab, we're going to input just that, all of our demographic information. So things like our name, our age. You'll see that the system auto sets or auto calculates current age, age at event date, and then also age at onset. And we will set onset on the clinical tab, and then we'll come back here and show you how that changes here. There is an address section. So Epitrax does keep a history for the address. And once again, we can see that this person here has had multiple addresses. It will specify for us what the most current address was. It will also allow us to choose one of these addresses as our address at diagnosis if we so wish. If not, we can come up here and we can type in our address at diagnosis. So we're going to go ahead and do that so I can show you some of the functionality here. Now you'll see once I get to state and I indicate that it's whatever the state is, in this case I'm going to say Nevada, the system is going to start processing. It's trying to hit against a address validation type of application. So something like Smarty Streets is what we will be using for Nevada. It will hit that application, it will validate the address, and then it will pull down latitude and longitude coordinates, and it will also validate and update our address here. So if I had made any spelling errors, or if it wants to update it to the Postal Service's conventions, it will do so at that time. I'm just going to go ahead and keep going since we don't have that. Once I hit county, it's going to try again. We can state here earliest known. Now I'm just going to, we'll say that we knew about this address in February. Whoops, I didn't actually click on a date in February, which would be helpful. There we go. You can state when they moved, the type of residence. This is actually a form field, and we'll talk about form fields a little bit later. But I can come down here and we can say, what do we want to say? We'll just say mobile home, why not? Then I can add a note that is associated with this address in the system. And then I can come here and click on Save as Address at Diagnosis, or I can come up here to Save and Continue. And I will go ahead and click on Save and Continue. While this is saving, I would like to kind of throw out there that Save and Continue is your friend. As you're going through the system, please make sure that you are saving and continuing often, that you are not going to lose all of the data that you've worked so hard to put in if your computer goes down or if your internet connection goes down. It's just really important to continue to do that frequently. You'll see an address here. Because I put that this was here's my address. Because I put here that my earliest known was 2/3/2022, it is going to save this as address at diagnosis, but it is not going to save it as current address because I had another address here, which I stated the earliest known was 9/2/2022. I think to Ben and Stephanie, that answers the question that Heather had earlier. So I'm really glad that I told her the truth about that one. So that's our address history. If we come down here, we can also specify telephone history. So we can specify our telephone type. We can go ahead and enter in our telephone number. Enter in the country code. So it's not asking for like a country abbreviation as far as letters. It's asking for the country code. So that 01 prefix that goes before phone numbers in the United States or whatever that might be for the appropriate country. Then we can also indicate our earliest known here. And then a note if need be. And then the same for our email address. We can type in our email address, and that will save once we click on Save and Continue as well. I would like to stop here and talk a little bit about birth sex. You'll see that here the birth sex is indicated as female, and that's because we already had an existing person record, and it pulled some of this information from that person record. If you are creating a brand new record, I would really encourage you to please make sure that you fill out birth sex, especially if you're going to need to indicate pregnancy. You cannot indicate pregnancy on the clinical tab if you have not said that the birth sex here on the demographic tab is female and then clicked on Save and Continue. It is the female indication here under birth sex, and then clicking on Save and Continue that will allow you access to the pregnancy section on the clinical tab. So I just wanted to make sure that we let you know that as well. And then, of course, other pertinent information, current gender, primary language, ethnicity, race. You can see here that you can indicate multiple race selections. And then these forms down here on the bottom are form fields, which once again, we'll go into more detail here later. Are there any questions so far on anything we've talked about so far?
Shannon, this is Selena. Sorry, I have a question. Is unknown an option? I couldn't see when you were doing the drop down. Like race or ethnicity. Okay, there. Yep. Yeah. Okay. Thank you. I may have missed that if you said it.
No, that's okay. And I I might not have, but yeah. Any other questions? Okay.
Sorry about that. I'm back.
That's okay. Welcome, Alex. And then we can come here to our clinical tab. That's our next tab. You will notice that there's some times where the system's thinking a little bit, and I apologize. My internet access has been pretty bad the last couple of days. I've been giving these trainings all week long, and I think maybe my modem's a little tired. I went and unplugged it earlier, and it was really hot, so hopefully we can get through today. This is where we would indicate disease. You can see it was already pre-populated because we did that earlier when we created the event. Here is our onset date. So we talked earlier about how we can come here. We can indicate our onset date. Once again, we can use our calendar, or we can type in the date. If I click on Save and Continue at this point, and then I go back to my demographic tab, you'll see here that now it's indicating the age at onset. It's calculated it for us. Going back to clinical, we could also set the date diagnosed. This illness information is form field specific, and we'll talk about that here later as well. We come down here, you'll see relevant comorbidities. So system administrators have the capability on the user interface to come in and to link certain conditions as comorbidities. We have created a Hep C event here, and you'll see that this person previously had a Hep B chronic event. So the system is letting us know, hey, this is a comorbid event in the system for this individual. Then I do have the option of either clicking here and going into this event, or coming here under options and editing or viewing the event, or going into the person record. Okay, so that's comorbidities. We'll talk about the hospitalization section here, and then we'll pause for any other questions or discussion. I'll just come over here to the far right-hand side and add a facility or clinician. Can come down to visit type. If I indicate that it was inpatient, it's then going to allow me to state whether this condition caused the hospitalization. So whether that's yes, no, unknown. Health facility. So you do have to search for health facilities in the system. You do not have the capability of manually entering them. This is to protect some of that data integrity and to make sure that we don't have 20 different variations on one health facility name. So I can just come here to health facility. I would encourage you to please use the entire health facility name first, and then as you're searching, maybe start going down to a more obscure search. And I'll show you why. So if I just put in hospital, I type it in, I hit enter, that initiates my search. I have a box that pops up. Hospital is a very, very, very vague search. And you'll see that you're only allowed, I think it's like 20, 25 choices here. And so I'm only going from the A's to the beginning of the B's. If my hospital name started with an F or a G or anything below the B's here, I cannot see it. So please make sure that you are typing in the entire name of that hospital. For our purposes now, I'll just come up and pick the Bakersfield Heart Hospital. You'll see that right now, there is no type or address, phone number. When I click on Save and Continue, that will populate that information for me. And you'll see here, boom, there's my type, address, phone number. Ever so often here in the system, you'll see this little eye icon. This indicates that there's some kind of instructional help. So in this case, if I hover over it, it's saying not finding the facility you were looking for. I can click on it, and it gives me some information here. Email your administrator to request a new facility be added. So in the case that you've performed your search, you can't find your facility, please go ahead and email the system's administrators, and they would be happy to add it for you or to help you find it. Okay, I can indicate whether it's a transmission facility or not, fully knowing that that's not really relevant to all conditions. Diagnosis facility, I can indicate that as well. So in both cases, yes, no, or unknown. I'm going to skip clinician for 1 second here and focus on visit start and visit end. So these are equivalent to your admission and discharge dates. And then your medical record number. I go back here to clinician. The search is very similar to that of health facility. Once again, the more information you put in, the better your search will be. I'm just going to enter Smith, enter. In this case right now, because it's the training environment, there aren't a lot of Smiths in here. I can come down, find my Smith. I'm going to choose Bob here. The big difference between clinician search and the health facility search is that I can add a new clinician to the system. So I can come here. If I hover over new, not finding a clinician, it's going to allow me to click here. I can add first name, last name, telephone number, and then I can click on Save Clinician, and that will add this clinician. In this case, I made a mistake and clicked Save Clinician, and there's not one there. I'll just search again for my Bob Smith. Okay. Another thing I'd like to point out here in the facility section is that you can add a facility comment. One caution here, and it is available here at all times, is please refrain from disease-specific comments. They may be visible in other cases. So please make sure you're not putting in any sensitive information that you wouldn't want everyone in the system to be able to see. Anyone who has access in the system can see the person records. And nested inside the person record is the facility history. And inside of that facility history are these facility comments. And it will look something like this. Anytime you see this green text, you can click on it, and it's going to bring down any type of history for this person. So in this case, our facility history, and you can see here that facility comment is available. And if there was any kind of text here, we'd be able to see that. So that is my caution to you. Also, as you're looking here under this facility history, if I decide, hey, you know, I want to save this Alta view to this event, I can click here. I can add this facility visit to my history in this event as well. I come down here, and then I could change my visit start and visit end dates if I wanted. So I can say, yeah, they went to this hospital again, but it was a different visit start, visit end. I can do that here. Okay, any questions so far before we continue? Okay. We'll just keep trucking along here. Under mortality status, because I said that this person has died and I indicated that here, I did have some follow-up fields that appeared, such as the death certificate number, enter in my date of birth, and it's always going to ask me if my condition caused the death, and I can indicate yes, no, or unknown. Pregnancy status, because I said that this person's birth sex was female, I do have the pregnancy status section. And then I can come here and once again, yes, no, unknown. I'll just say yes. And then I can come over here to the far right and add a pregnancy. This is what that section looks like. So I could enter the number, the expected delivery date. I can search for my expected delivery facility and do the same for the actual delivery facility. I can indicate insurance for the mother, so whether that's uninsured, insured, or Medicaid, and then the same for the infant. And then I can indicate an outcome for this pregnancy. Cancel that. If I say, well, I know that this person had a previous event because, right up here, we're saying that they had Hep B. I suspect that their pregnancy might already be in the system. I can come here to other pregnancies. I can see here, oh, look, yes, they do have a pregnancy and they're not due until the 15th. So I could go ahead and add this pregnancy to my current event as well. So really trying to save maybe a little bit more time and effort here, and then that's added. Treatments, I can do the same. I indicate whether a treatment is given, unknown, yes, no. If I say yes, it pulls up the treatment section, and I can indicate treatment start and stop dates. Treatments are still being loaded into the system for conditions, but if there was a treatment list here, I could click on my treatment, indicate which treatment it was, and then fill out the rest of the information for that treatment. And then our last section here for the core fields would be vaccine. If I indicate that yes, I want to add a vaccine, I could come here. The vaccine list is still being updated as well. If there's a vaccine that is relevant to a condition, I could click on vaccine. If not, then obviously there won't be any here. Administered date, dose number, all the pertinent information for vaccines. As in the pregnancy history and other histories, if there was a treatment history, there would be that green hyperlink here that I could click on. I could add other treatments from other events, and same with vaccine. These fields down here are form fields, and we will talk about those in our next session. Are there any questions so far? Oh, actually, before I open it for questions, I also did want to point out that we are in the midst right now of working with the WebIZ folks for Nevada and integrating WebIZ with Epitrax so that this vaccine information can be populated for you. And as that happens, I'm sure there'll be more information that will come out to let you know what that will look like and how that can be used. Okay, we'll pause there and see if there are any questions so far.
I do have a question.
Sure.
So since I am just part of like the GBC, we just do COVID, right? Like we don't deal with hepatitis, or I'm a little confused.
You might just deal with COVID, and if that's the case, that would be the only condition in the system that you would have access to, and those would be the only cases that you would deal with.
Okay, and then I just want to make sure, so like all of the tabs that you were going through, like the address and all that, like I need to, when I call a person, I need to kind of like ask them those questions and like see like if I guess kind of interview them and fulfill all of those tabs, correct? Sorry, it's because I've never like done this before.
Yeah, that's okay. No problem, Kaylee. As I said at the beginning, a lot of these cases are already going to be created for you. So hopefully, by electronic laboratory reports that come in or electronic case reports, in those instances, that demographic information, most of it would already be filled out. But as far as calling and doing your investigation, that might be something that you might want to talk to your supervisor about, what they want you to do and what kind of information they want you to gather. Today, we're really just talking about what you can do with the system and how you can use it. But I know that every jurisdiction has their own processes. So that might be a good discussion for you to have with your supervisor as far as what they want you to ask and how they want you to input the information. Does that make sense?
Yeah, I just want to like make sure if I guess not just fully fulfilling, but also just kind of like reviewing, oh, do you still live at this address and stuff? I guess that was like my question. But yeah, I understand what you're saying. I have to ask my Amber, that's her name. Okay, well, thank you so much.
Yeah, you're very welcome. And I've had the opportunity to talk to Amber a few times, and I'm sure that she'll be a wealth of information for you. She seems to know quite a bit. So, okay, so if I click here on the laboratory tab, we'll show you how to enter laboratory results. Most of these, once again, will come in through electronic laboratory reporting or electronic case reporting. But in the situation where you have to actually enter them in, you can come over here to the far right, click on Add Lab. You'll see that there are 2 fields here that are highlighted in pink. That indicates that they are the minimum necessary in order to save a laboratory result in the system. I would encourage you, however, to enter in as much information as you possibly can, because you really can't get very much out of just a performing lab and a test type. We'll go ahead and type in our lab here. If I go ahead and hit enter, that's going to initiate my search. And once again, the more information you put in here, the better your search will be. I just put in LabCorp. Going to come down here. I can choose whichever one I want. We'll just choose this one here. Why not? You can do the same with ordering facility, and then ordering clinician is very similar to the clinical tab here. The patient address at collection. So I can associate an address with my specimen collection here. So it brings up the entire address history for this person. I can come down here and say, oh, well, this is the address I just put in, whichever one that was. I don't remember at this point. So I'll just click on one, associate the patient address at collection. I enter in my collection date and time. I can type that in the format specified, or I can come here and you'll see that this time there's a little hour-minute slider for me. If I click on current date, it's going to default to today's date and then also the time at which I clicked my little button here. I can click the close button, or I can just go ahead and click outside of that dialog box. I can specify a specimen source. So whether I type it in to initiate that search, so we'll just kind of, you can spell, that helps too. Or I can come down here and just select an item from the list, my session number, whether the specimen was sent to state lab, no, unknown, yes, my test type. I can, once again, type it in and choose, or I can just choose from my list. Organism, same way. My test results, a test status, a variety of different status choices, and then finally my lab test date and time. Now, once again, I can use my little sliders. Okay, so that is how I create a laboratory result in the system. I'm going to go ahead and click on Save and Continue, and then I'll show you how you can add a test to this specimen collection and add a susceptibility. Any questions so far about entering in lab? If I click here, it's going to bring down my list, you will see here that it does indicate right now that the test count is 1. My test type was PCR. My organism is Hep C. Result is positive. Now we're going to go ahead and we're going to add an additional test to our specimen. So sometimes they'll take one specimen and do a panel on it. So we can come here and we can say that our test type this time, I'm just going to choose something randomly. We'll just say culture. Our organism, once again, our test results, and so on. So that's how we would add an additional test to this specimen. We can also add susceptibilities to tests. I fully realize you wouldn't necessarily have a susceptibility for hepatitis panel, but we're just going to do it for demo's sake. We're going to come down here to our antimicrobial agent. I can either click on my antimicrobial agent, I can search for it. We'll just do ertapenem, my results. So whether it's intermediate, resistant, or susceptible, my results value, and then once again, my test date. Okay. Then when I come up here and click on Save and Continue, you'll see that my display on the Lab tab is going to change a little bit. It's now indicating that my test count is 2. This S indicates to me that there's a susceptibility result. If I hover over it, it's going to let you know that as well. You'll see that the test type also changed. So it's going to display the last test that was associated with your specimen. So we'll see here that it changed to culture. And then, of course, the organism was still Hep C and a positive result. As in other places with our green hyperlinked text here, I can click on it. It's going to show me other patient labs. And then I can drill down and see that these are my Hep B labs. If I decided that I wanted to add these to this event as well, I could click here, and then I could add this lab to this event. Any questions so far? Okay, let's talk about contacts. There are a variety of different ways to add contacts to a morbidity event, and we're going to talk about those. So the first way is this field right here in the upper left corner, link an orphan contact with a record number. So let's say that you had 2 morbidity events that were created and you started your investigation here with Shannon Sandel test. And during the course of the investigation, you realized that, oh, well, this other morbidity event should be a contact event that's nested here under Shannon. I can grab the record number for that second event, put that record number in here, click up here on Save and Continue, and now that person will be linked to my morbidity event as a contact and will be listed here. And I'll show you here in a moment what it looks like as those contacts are listed here. Another way I can add a contact to a morbidity event is to come here and search for someone in the system. So say last name, Sandel test, and we'll do first name, Pixie. Go ahead and hit enter. You'll see that the system brings up Sandel test Pixie. I can see the date of birth, gender, telephone number, and then I'm like, okay, yeah, this is my person. So I can come over here. I can click on add contact, and it's going to add this person as a contact here under my morbidity event. And the system's going to tell me, yay, successful contact added. Okay. Let's say that I'm going to clear this search here. Let's say that I search for someone and they're not in this system. So come here, enter in the name, either hit enter or come over to search. Nothing comes up in the system. I am kind of a skeptic sometimes when that happens, so I am going to probably try to search a second time because that's just who I am. And then I'm going to say, okay, no one's come up in the system. I think I'm safe. I can come here, click create person and contact. And then you'll see it's going to create this person's record in the system, and it's also going to associate them as a contact here for me. Okay. There is another way of associating contacts to morbidity events. So if I come here to import, I'm going to leave my page. I can come up here in the top left corner on options. I can either upload an import file or I can download a template. We're going to download the template so you can see what that looks like and then show you how we import it. I can come here, grab my file, wherever it might decide to appear. There we go. I'm going to click on enable editing. So this spreadsheet here could be your good friend. You have the capability of taking it with you out into the field where you might not have very good internet access. You have the capability of using it to enter multiple contacts at any given time, and then just upload it all at one time into the system, as opposed to going through the process we just went through for each individual person. You'll see here that in the top right corner, there's a little red triangle that gives you some helps. So whether it be that this is required, or the birth sex needs to be M or F instead of writing in male or female, or the valid way of entering in a phone number. So there are lots of different helps. And you'll see that there's lots of different information here that we can fill out. So we'll just come over here to first reported to public health date. And I entered way too many zeros there, so we'll go ahead and delete one of those. Our person first name, last name. We can enter in a middle name or a middle initial, a birth date. And we can enter in their sex, etc. We're just going to stop there for our purposes today. Can come here. I'm going to save this file. Please make sure as you're saving that you follow any best practices that have been established for protecting that PII. It's really important that we make sure that we're keeping everything secure. Then come up here to the top right-hand corner, exit out of my spreadsheet. Then here under options, I can click on upload import file. Browse, it's going to open up my Windows browser here. I'm going to click on my template, specify my event type as contact, and then click on submit. You'll see now that the system is telling me that my file has been uploaded, that there's one record, no invalid, nothing imported. If I click here, it's going to bring down that information and show me what it's going to look like when it's imported. And I also know it's not imported because there's no record number here. My next step is to click on import. And then you'll see my batch status is changed to imported, uploaded 0, invalid 0, 1 imported. If I click here, then I can see that it's been imported. It gives me a record number. I can click on this record number and go into my contact event. We're not going to do that right now because we'll show you what that looks like here in a minute. I'm going to come back here to my parent patient or my index patient, and then we'll go to contacts, and you'll see here that it's been uploaded. Okay. Any questions so far about contacts or how we associate a contact event with a morbidity event? Okay. From here, I can indicate the contact type, so whatever that might be. My contact disposition. There are a variety of different dispositions as well. My disposition date, which I can either type in once again or use my calendar function. You'll see I have the hyperlink here to get in and edit my event, or I can come over here to the left to options and either edit or view my event. I can remove my contact, or I could edit or view the person event. If I go into this contact event, we'll see that it has all of the same tabs that we had in our morbidity event. There are a few differences. First of all, there's going to be a link here to our parent patient. It will not display any case status information. And if I come down here to the very bottom, it's going to give me all of my contact disposition information. If at any point during my investigation, this person becomes symptomatic or they test positive, or any reason I would have to promote it to morbidity, I can come over here to options, promote, and then I can promote this contact event to a morbidity event. It would then be participating in the workflow, and I could also at that point in time set a case status. It would continue, however, to be linked to my parent patient. Any question at all about contacts or anything else we've discussed? Okay. Let's go ahead then and talk about encounters. So if I come here to encounters, you'll see that there are two different types of encounters. There's just this regular encounter and our follow-up encounter here. We'll talk about the regular encounter first, and then we'll follow up with the follow-up encounter and talk about the differences. So if I come here and click on encounter, it's going to pop up my encounter screen. You'll see that I default as the investigator, but if someone comes in and calls my patient here or goes to visit them or whatever, I can indicate a different investigator. And I should back up a little bit. Encounters are just that. They're any type of encounter that you're going to have with the individual during the course of the investigation. And encounters can take place in different locations. So whether that's on the phone or a clinic visit or a home visit, whatever that might look like, the system will require you to enter an encounter date and time. And it also requires some kind of an outcome. So whether you left a message or scheduled an interview or whatever the case may be. It does not require you to add a description, but as in other cases, the more information you provide, the better. Okay. At this point in time, I will come up here and click on Save and Continue. That's going to save my encounter inside of my morbidity event. Then I would have to come here and click on Edit Encounter Form to go into any forms that might be associated with encounters for this condition. So maybe some kind of prescribed questions surrounding encounters with this person. There are no encounter forms currently developed in the system, so we're not going to spend time going in there. But under this scenario, I would have to create my encounter, then click on my edit encounter form, go into the form, fill out all of my form information, click on save and continue again. So there are lots of different steps. This add follow-up encounter can save you some time there. If you know that there are form fields that are associated with encounters for this condition, I could click on add follow-up encounter. I could come in here and then kind of cut down on some of those steps, and we'll talk about that. So you'll see that this is a little bit different. This is coming up inside of the encounter event, outside of that morbidity event. You'll see that it has some of the same information, so that investigator, the encounter date and time, location, the outcome, but then it's also going to list the symptom onset date here, if pertinent, the isolation period, and I can type in my description. But at this point in time, you'll notice that there is another tab here, the investigation tab. This is where that form information will be housed if there is a form that is attached to this encounter for this condition. This will save you some extra time from going in, creating the encounter, save and continue, going back into the form. This is just a one-stop shop here. If the form was here, I could enter in all my information. Then I come up here. We've talked about how save and continue is really important when you're inside of the event and going back and forth between the tabs and some of the fields. Save and exit is important for when you want to unlock that record. Epitrax has a locking functionality. So if you are in and you are editing a record, no one else can come in and edit that record at the same time. They will be able to come in and view the record, but they cannot edit it. Here, if you're in this follow-up encounter, you can encounter a lock as well between the encounter event and the morbidity event. So if I just come here and click on save and continue, I am not unlocking the record. That record will continue to be locked. And then if I go back to my event, you'll see that my record is going to be locked for my event. Okay. So I know that it's locked first and foremost because I get here and it's in view only mode. I cannot edit anything. So that's my first indication. My second indication is up here on the top. It states person locked. If I hover over that, it's going to tell me who locked it, when it was locked, when I loaded it last, or when they loaded it last, and then also the email address for that individual. So in this case, obviously, I did it to myself. But in some cases, when you go into a record, it will be locked by someone else. And now you have their contact information. So you could say, hey, Shannon, could you please let me know when you're going to be done with that record so I can go in and make some edits. Then, when they're done with it, they can go and hit that save and exit and be done if they forget to do that. Or if in this case you lock it on yourself, you do have the capability of unlocking it. So you can come up here to the top right and you see we have a few different options. If I hit on force lock, if I just say, hey, force unlock this, it is going to unlock the record, but then I have to go through an extra step of editing, clicking on edit the event. If I just click on force unlock and edit, it's going through both steps at the same time and save me that extra click. And so now I'm back in my event record. Are there any questions about encounters? Okay. Let's go ahead and talk about the investigation tab. So here in the investigation tab is where we will manage those forms that I referenced here a couple of times previously. And we'll come back and we'll talk about this in our next session. For now, we're going to come down a little bit further and we're going to talk about the contact-oriented section. So you can indicate things like industry, occupation, food handler, healthcare worker, etc. And you'll see here, if I click on one of these, it's going to give me a yes, no, unknown. Okay. Then if I click yes under healthcare worker, for example, then I can add a healthcare facility. Okay. If I come down here to exposures, I can add an exposure. I can enter in my exposure place, click on my enter key on my keyboard, initiate that search, or I can add a new exposure place by filling in all the pertinent information and then clicking on save exposure place. And then I can enter in my beginning and ending dates and any description. Then we have our travel. So if I come here and add a travel, I can indicate the country. If I say that the travel took place inside the United States, then it allows me to choose the state. If I choose Nevada, then it would allow me to choose the county. So whatever that might be. And then I can also enter in the city or start and end dates. Under other travels here, if I click on that, you'll see that this person has another travel that's already associated with their person record. And then if I click on add to event, I can add this travel to this event as well. And then the last section here is other. So imported from, whether that be unknown, indigenous to Nevada, outside the US or other US state. My binational reporting criteria, and you'll see that there's a little instructional or informational icon here. And it's going to state this data will assist CDC in facilitating information sharing with Mexico and Canada for cases and outbreaks that may require binational public health action. And you'll see here there are various criteria here to choose. And then my transmission mode, so whether that be bloodborne or foodborne or droplet or whatever the case may be here. I can list out my risk factors, associate risk factor notes, and then these other data 1 and other data 2 are kind of freebie fields in the system, so they can be used however the state or local jurisdiction deems necessary. Okay, are there any questions on the investigation tab? The notes tab. So this is where you would come to either add an attachment or to view attachments. So to add an attachment, we just come here to add attachment. We can choose a category, whatever that might be. We can click on attachment uploader. It'll take us back to our Windows folder here. We can click on here. Then we can decide, here's my attachment. Do I really want to upload this? Yes, I do. So I'll upload the selected file. Now we can see that our file's been uploaded. We can upload a variety of different files. So anything from like a JPEG, PDF to any type of a text document and a variety of other types of files. We can add a note. So if I come down here, I can bold or italicize or underline. I can change my font. I can change the size. We can also change the color of the font and highlight. I can also do bulleted or numbered lists, do some more formatting here with my paragraphs. I can hyperlink. So there are lots of different functionalities here inside of Notes as well. Are there any questions about our Note tab or Anything that we've discussed so far? Before we leave this tab, I'd also like to point out that once an attachment has been uploaded, you can download the attachment. You could delete the attachment. We will talk about tasks in our next section, our session together. So I'll go ahead and skip tasks for now. Let's go ahead and talk about the administrative tab. So here on our administrative tab, you'll see that there's a wealth of information, including our record number once again, the MMWR year and week, the date the record was created. You'll see here, local health department case status resides here on the admin tab. That's really important. You all will be performing these investigations, oftentimes closing out the cases on your side. And when you do so, it's important for you to indicate this local health department case status. I've been told that you currently do that and that I was asked to point out to you where this information resides. So it is here on the administrative tab. This local health case status will be used to help determine the state case status. And that is the trigger that sends any cases to the CDC. So it is important. You'll see here next, we have outbreak associated. So we can indicate whether this event is associated with an outbreak. So we have our yes, no unknowns here. If it is an outbreak associated event, I can come here. If there are outbreaks that are listed, I can click on the outbreak and associate that outbreak. If there is not an outbreak that is listed, but I feel like there should be, I can contact the systems administrators and ask them to please create an outbreak for me. There are not currently queues or tags in this system, so we won't talk much about those today, but they are designed to help you with some of your case management. And so when they are available, I'm sure that there will be more communication that will come out regarding those. When we come here next to our auditing and investigation, you'll see that there are a couple of different dates here. LHD investigation started or completed. There is investigation outcomes, reporter information, reported dates, and then this information down here is form field. And like I said, we'll talk more about that in our next session. Are there any questions? Okay, that covers all of our tabs inside of our event. I'd like to come up here and we'll kind of work our way backwards. So we already talked about save and exit. When I am completely done with the record, I want to come up here and save and exit. That will unlock the record and allow other people to get in and edit. Throughout the course of my work inside of the record, I want to make sure that I'm clicking on save and continue often and early so I can save my information. This also tells the system that you are still working in the record. And so that will indicate to the system that, hey, you know, don't time me out. There will be a timeout that will be set on the system. So if you are not actively clicking on save and continue, that timeout time will begin, and you might find yourself logged out of the record. So just make sure that you're clicking on save and continue. This little icon here is our printer icon. If I click on that, it gives me some print options. So I can come here and click and print all, or I can come down here and I can just print from certain tabs. If I click print, you'll see that that is printing to a PDF. Also up here, you'll see that there's some workflow. So workflow inside of an event can be managed either over here or over here under workflow options. When accepting an event, I can do so from either place, so I'll just do it over here. After I accept the event as a jurisdiction, I can then assign to an investigator. So once again, I can either do it here or over here. It will pull up a workflow action box and it will ask me to select my investigator. So you can either select yourself or someone else inside of your jurisdiction. Go ahead and click on me. This is where making sure that your name is entered in on the settings up here in the top right is super important. If your name is not associated with your user account, you will not see yourself listed here as an investigator, nor will anyone else. So while I could see that it might be appealing to not enter a name in, I would encourage you to do so. So then I can come here, click on Assign to Investigator, and you'll see now that under Investigator, it is listing my name as the investigator. If I come here and click on the investigator, it's going to provide me with that investigator's contact information. So if I had entered a phone number, that would be listed here. And once again, entering that phone number back in the top right in the settings. And then it will also display my email. And this will allow other people to contact me should the need arise. If later on I am on vacation or I'm ill or something along those lines occurs and someone needs to come into the event and route it to someone else, they certainly can just by going up to workflow options, assign to investigator, and then taking the same steps that we took earlier. If during the course of my investigation, I decide that, hey, this should not be assigned to Carson, this person lives out of state, or possibly they live in another jurisdiction in state, I do have the capability of once again coming to workflow options, clicking on route to local health department, and then I could come here, select my new agency or jurisdiction. So whether it be ELCO or that out-of-state scenario that we just touched upon, I can click on route to local health department, and then this event will transition over to the other agency. Okay, going to stop there. Are there any questions so far about anything that we've discussed today? Okay.
Quick question.
Yes.
Regarding linking patients, do you need to link on both sides, like one patient to the other, or do you just have to do it once?
Just has to be done once.
Okay.
So it can all take place here in the parent record. You can link them directly here, and then that link goes across both. Any other questions? Okay. Ben, I think that's where we're going to stop for this training, and then we'll pick up from there.
Sounds great. Thank you so much, everyone, for joining. I think, yeah, we'll pick up again this afternoon for the remainder.
All right. Well, thank you, everyone. We'll talk to you soon.
I have a quick question.
Yeah.
Is the meeting gonna be at 2 later, and then we use the same link for that we used on this video call for at 2?
Ben, I think is that the way we're doing it?
I'm not sure. I guess it depends on how Google Meet works. I'm not sure if you need to send a new link for the meeting or what.
No, we can use the same one as far as Google Meet's concerned.
Okay, let's do that then.
All right, let's use the same one, Kaylee.
Okay, and it's at 2, correct?
It is at 2:30.
Oh, 2:30. Okay, thank you so much.
Yeah, of course. See you then.
Thank you.
Bye.
Bye-bye.